Hi, my name's Aaron McDonald. I'm an anatomy lecturer at La Trobe University in the Bundoora campus, and in this clip I'll be continuing on with the intrinsic muscles of the foot, looking more specifically at layer 4 and a quick revision of the other muscles in layers 1 to 3. So layer 4 is our deepest layer of our intrinsic muscles in the sole of the foot. It contains tendons of extrinsic muscles, so muscles running from the leg running into the foot, and tendons that are found in this fourth layer are tibialis posterior and peroneus longus. The intrinsic muscles in the sole of the foot are called as a group interossei. Inter meaning between, and osseous is bone, so these muscles are found between the bones, so between the metatarsals in our foot. There are 3 plantar interossei, so found a little bit more on the plantar surface between our bones. And a way to remember the actions of these muscles is to remember PAD. So PAD is plantar adduction. Plantar interossei, whenever they contract, will produce adduction. We have 4 dorsal interosseous muscles, so these are found slightly more dorsally than the plantar interossei, however they are very close together. The actions of these dorsal interossei can be remembered by remembering DAB, dorsal abduction. So the dorsal interossei muscles, when they contract, will produce abduction. Here we have again the diagram of the bones of the sole of the foot, the plantar surface of the foot, and we have a couple of other structures to orient ourselves. We have the flexor retinaculum, and as we know, that is found medially. And again, we look at our hallux, or our big toe, to indicate medial. We have a structure here called the spring ligament, and that's a ligament that is attaching from our calcaneus to our navicular, and it encases the head of our talus. We have another structure here called the long plantar ligament coming from our calcaneus all the way to the base of our lateral metatarsals. And this little structure here is just indicating that we have a groove found in this bone here, which is our cuboid. So there's a groove in the cuboid you may be aware of as well. So initially, the 2 extrinsic muscles in layer 4 are this muscle here running through deep to the flexor retinaculum and inserting into the bones, the plantar surface of the foot, and another tendon running from laterally through the groove in the cuboid and inserting onto our medial cuneiform and our base of our first metatarsal. So if we can pause the video now and try to determine what the name of these muscles are. Hopefully you were able to determine that this muscle is running through flexor retinaculum. You may have remembered Tom, Dick and Very Naughty Harry, and you remember that Tom is tibialis posterior. You may remember that any muscle running laterally will have peroneal in its name. So this muscle is running laterally, running through the groove of our cuboid, underneath the long plantar ligament and inserting the medial aspect of that plantar surface. And here we have the tendon of the peroneus longus. So these are the 2 extrinsic muscles found in layer 4. As indicated in a previous clip, the long axis of the foot runs through our second digit. So any movement away from this long axis is called abduction, and any movement towards the long axis is adduction. So here we have some intrinsic muscles found between the bones, so we can call them interosseous muscles. So for interosseous, inter between our bones. And these muscles here, as you can see, are running along and they attach to the base of our proximal phalanges, and they can also continue on and insert onto the extensor hood. But looking at the insertion onto the base of our proximal phalanx, if this muscle contracted, it would it would cause the digit here to move towards the midline, hence adduction. Again, this muscle here would cause this digit to move towards the midline and adduction. We remembered pad, and therefore remember plantar muscles, plantar interosseous muscles produce adduction. Again, we have our long axis of the foot, and we look at our muscles here, and these are found between bones, so therefore we can call them interosseous muscles again. And looking at where these muscles are inserting, we can see that, for example, this muscle here, our most medial or our first muscle, will be running and inserting onto the base of our phalanx here. And if this muscle contracted, it would result in our second digit moving away from the midline, and therefore producing abduction of our second digit. Here, this muscle inserting onto this side of the base of our proximal phalanx will result in my second digit moving away from the midline, and there will be abduction. And again, these muscles here, abduction and abduction of our digits. Dorsal interosseous produced abduction by remembering DAB. So therefore, any muscle that is producing abduction of our digits must be a dorsal interosseous muscle. Just a slight revision on the extensor hood, and just looking at what muscles are helping to form or insert onto the extensor hood. We have our extrinsic muscles, our extensor digitorum longus or extensor digitorum brevis, or for digit 1, extensor hallucis longus or extensor hallucis brevis. So we see our digitorum longus and brevis inserting and forming our extensor hood. The tendons of these muscles expanding over the proximal phalanges and forming our extensor hood. The lumbricals and the interossei also insert onto the extensor hood. I can determine that this is a lumbrical as it's originating from the tendon of flexor digitorum longus. It is running on the plantar surface compared to the deep transverse metatarsal ligament. So it's running on the plantar surface relative to my metatarsophalangeal joint, and it will produce flexion at this joint. But as we see, it runs up and inserts onto the extensor hood. So the action it will place on our proximal interphalangeal joint and our distal and interphalangeal joint would be extension. Our dorsal interosseous muscle running deep to the deep transverse metatarsal ligament, but also running and inserting onto the extensor hood, so therefore will also produce extension at my proximal interphalangeal joint and my distal interphalangeal joint. I'd just like to comment on a couple of principles. We have a principle that muscles lying more superficial layers of the sole of the foot will originate more proximally. So we can see the abductor hallucis brevis is found in layer 1, and it originates more proximally than the quadratus plantae, which is found in layer 2. So we have the idea that superficial muscles are longer, and as we travel deeper, the muscles become shorter. We also have a principle that muscles of the sole insert just distal to the most distal joint upon which they act, and as we can see, all of our muscles are inserting just distal to the joint that they're acting on. For homework, I would like you to try to label all of these muscles in this coronal section of the foot through the metatarsals, and also this diagram here. Thank you.